CLOMID, clomiphene, clomiphene citrate. All these names adorn a very powerful pill that plays a significant role in the reproductive world. So, what is this precious jewel, popularly known as CLOMID? This is what this video will help you to understand. On the same hand, you will learn how to achieve pregnancy with it and signs to show that you are pregnant with CLOMID. If you are interested in this topic, stay tuned and keep watching. Hi phenomenal viewers, this is Get Value with Nurse Chinyere, and in this channel we get to discuss everything related to reproductive health. If you are seeing this face for the first time, this is Nurse Chinyere Mary Ann, a registered nurse, registered midwife, registered public health nurse, and a bachelor's degree holder in nursing science. It's good to have you here. Please do well to support this channel by subscribing to it. Remember, subscription is free. And to my returning subscribers, you guys are super amazing. Thank you for always sticking around. Now let's get straight into it. CLOMID is a non-steroidal fertility drug that is used in women who are having difficulty ovulating regularly each month, or women with anovulation leading to infertility. Anovulation simply means menstruating without ovulating. On a normal ground, every woman is supposed to ovulate in each menstrual cycle. But in a situation where there are some irregularities, CLOMID comes into play. It is also used to induce ovulation in women with PCOS, that is polycystic ovarian syndrome. This condition prevents naturally occurring ovulation. However, research has shown that a medication known as letrozole is more effective in inducing ovulation and achieving pregnancy in women with PCOS. CLOMID is also used in women diagnosed with unexplained infertility that has been actively trying to conceive and has not been able to conceive after a year of trying, and fertility testing does not identify a cause. CLOMID simply works by sending a message to the brain to release the hormones FSH and LH. FSH simply means follicle stimulating hormone, and LH luteinizing hormone. These hormones help to stimulate the ovary to release an egg or more at time of ovulation. Ovulation is a phase in a woman's menstrual cycle where an egg or more is released. All things being equal, if there are no reproductive issues with the man as well as the woman, this egg is fertilized by a sperm to form a live. In an average menstrual cycle of 28 days, ovulation typically occurs on the 14th day. So like I said earlier, this pill helps stimulate ovulation, helping women to achieve pregnancy. However, it is sad that a lot of people abuse this pill. It is not for everyone. Before you start taking CLOMID, it is important to find out the reason for not conceiving, because it is not every couple having difficulty conceiving requires CLOMID. There are a lot of factors that can hinder you from conceiving, like blocked fallopian tubes. These tubes are like a passageway for the sperm to meet and fertilize the egg. So if blocked, there is no way for the sperm to meet and fertilize the released egg. The egg is then stopped. So a woman can actually release egg or eggs without being fertilized. Other ones are fibroids, uterine abnormalities, or other infertility factors from the man, like low sperm count. So ensure you are taking CLOMID for the right reason, because abuse of this pill can cause hyperstimulation, leading to release of multiple eggs that may end up not being fertilized due to blocked fallopian tubes or other factors I just mentioned. Before you start taking CLOMID, it is important that you and your partner visit the hospital to see an expert who would help you determine the cause of your infertility. Some tests may be required, like hormonal assay, to determine if the cause of your infertility is actually low levels of FSH and LH. Then CLOMID can be taken to increase the levels. Semen analysis for your partner can also be done to evaluate the volume, concentration, morphology and motility of the sperms to rule out those sperm counts, as well as other tests as required by your physician as the case may be. CLOMID usually comes in 50 milligram tablets. It is a prescription only pill. What do I mean? It is only your physician who can prescribe this medication tailored to optimize your menstrual cycle. You need proper guidance before taking it, while taking it, and even after taking it. It is taken 50 milligram, 100 milligram, 150 or 200 milligram for 5 days according to how your physician wants it, considering your medical condition. Some people will ask, how should I take CLOMID? This pill is taken according to a woman's menstrual cycle length. It is usually started on the 2nd, 3rd, 4th or 5th day of your cycle, with day 1 being the day you have a menstrual flow and not just light spots. It is advisable to take this medication at a particular time in a day. You can decide to take it in the morning or at night so as not to forget or miss a dose. You can as well set reminders to help you remember to take your medication. But in a situation whereby you accidentally miss a dose, call your physician for additional instruction. It is very important to start monitoring ovulation after taking the last dose, that is from the 6th day. It can be done through an ultrasound scan. Here, the ovaries are visualized to check for growth and development of the follicles. Having an idea of this will help your physician recommend when the ovaries are matured enough for you to have sexual intercourse for maximum results. Once this positive sign becomes obvious, it is important to have sexual intercourse within the next 24 to 48 hours to increase your success rate. However, both partners should take it easy and enjoy themselves during this process. There are some potential side effects associated with CLOMID. Just like any other medication out there, CLOMID has its own side effects like pelvic pain, breast tenderness, breakthrough bleeding or spotting, headache, nausea and vomiting, hot flashes, multiple pregnancies. Due to stimulation of the ovaries, they can be overstimulated to release more than one egg, resulting in multiple pregnancy. What is the success rate? Approximately 7 out of 10 patients treated with CLOMID will ovulate and 4 out of 10 will conceive. This is because fertilization and implantation will occur for conception to take place. How then will you know you are pregnant with CLOMID? The first sign is missed period. However, missed period can be as a result of stress, sickness, and so many other factors. It is important to undergo pregnancy tests to confirm that you are pregnant. Other symptoms include morning sickness, breast tenderness, fatigue, and so on. After confirmation of pregnancy, it is important to keep up with antenatal visits and appointments. I wish you all success in your pregnancy journey, and don't forget to stay healthy and happy. We have come to the end of this video and I hope you all got value from it. If you have any question for me, kindly drop in the comment section and I will be there to respond. Please support this channel growth by subscribing to this channel. Be generous enough to share my videos to people that will also benefit from it. Like my video to help you to push this video to people that will also benefit from it. And finally, turn on your notification bell to get notified when I post more content. See you all in my next one. Bye.